While balancing the public's right to know and patient privacy, that is the issue being debated today after the Maine CDC recently issued a health alert stating an outbreak of chickenpox in the state. WMTW News 8's Jim Keithley joins us now with more on this. Jim.
Tracy, the CDC says 84 cases of chickenpox have been reported this year. Cases reported in every Maine county, they say, except Washington County. And that's about all the CDC will divulge. Some doctors say that the public should be told where the outbreak is most common and which schools are hit the hardest so people can protect themselves.
A day in the park turned to conversation surrounding the latest chickenpox outbreak announced by the Maine Center for Disease Control. The CDC says most of the children were either unvaccinated or undervaccinated. They say it may be because parents do not consider chickenpox a serious illness.
Well, if they're not vaccinated, they're going to have an outbreak. It's ridiculous.
Throw for the duckies.
At the Riverside Park in Westbrook, Tammy Nappy of Scarborough said that she's concerned, saying her youngest son contracted chickenpox after her mother got a bad case of shingles.
It was mild because he was vaccinated. Had he not been, it could have been terrible.
Dot Ziba, a retired nurse, was at the park too with her 2-year-old granddaughter, Ariana.
I think we have a right to know. I think it's a safety issue, a health issue. I'm a health professional, so I would want to know.
The Maine CDC says it has a policy to protect personal privacy, and in a statement today said information that may reasonably lead to the identification of an individual's health status, as with identifying such a small number of schools with such a small number of children, could reasonably lead to a prohibited identification of an individual. Dr. Laura Blaisdell is a pediatrician and disagrees, saying there are patients at risk of dying if they don't have information about outbreaks.
The risks to people who are immunocompromised, the risk to people who are pregnant, the risks to children who have not been vaccinated are high. And so this is a perfect example of when knowledge might allow individuals who are at risk to make different decisions about where they go to school, where they go shopping, or how they protect themselves in the community.
The CDC says it is still too early to tell whether the increase in chickenpox cases is a fluke or the beginning of an upward trend. The agency says it would like to see a trend of more than 2 years of stats, to be sure. We're live in the studio. Jim Keithley, WMTW.